One of life's aesthetic endowments that most people take for granted is smiling in the face. However, not everyone has this luxury of enhancing their face and expressing either their approval or affection by this gesture. To some people in the Bongo District of Ghana, smiling in the face comes with a psychological trauma as they dare not exhibit their dental formula lest they get stigmatized. This all because of a condition known as fluorosis of the teeth that makes exhibition of teeth an embarrassing episode. The St. Andrew's Clinics for Children, a Scottish charity, and its Ghanaian counterpart are sponsoring a team of volunteer dentists, scientists, communication experts, beauty ambassadors, and administrators to help with eliminating this condition, as well as providing outreach for improved oral health care to school children in the Bongo District.
I'm trying to inspire everybody to get their teeth clean and know about the water and things like that, so that they want to have big, bright, happy smiles, because you always feel more confident when you have that.
The initial objectives was to go and look at parasitic diseases, infections in children and treat them. Now, that is simply because we know that if you deworm school children or get rid of the parasites, their cognitive abilities and everything else. But when we went to Bongo, we found another problem, which we thought was also more serious in terms of what it brings, social stigmatization, and that was fluorosis. And later on we found out that the underground water is so high in concentration of fluoride that they end up having fluorosis. Children end up having fluorosis. Their teeth are mottled, brown, and we thought we should do something about it.
Fluorosis is a condition associated with brown coloration of teeth due to the consumption of water that is contaminated by excessive levels over 1.5 ppm of fluorides.
Water table, we have a higher water table and a lower water table. The lower water table is usually safe. With the higher water table, when we have this associated mineral concentrated, fluorine concentrated somewhere, and you know the water goes round. Perhaps where we have our sources of the water recharge, that is when it rains and the water passes to the water table, it might encounter this concentration of fluorine somewhere along its path. And then fluorine is very soluble in water. Then it contaminates the water.
The boreholes are not enough to serve all the communities. So now they are even basing the boreholes to schools and then some highly indented communities. But when the children come to the school and use the quality water and go back to the house, they go and use the water that is still not of good quality. It still have effect on the thing. So we are still battling with that.
Basically what we're doing is going to the schools and picking up some of the children with very severe cases, bringing them in, advising them the importance of oral health, teeth cleaning, and how we can correct some of the defectives with reference to the dental fluorosis problem that they're having with their drinking water.
Regular consumption of fluoride contaminated water by infants in their enamel teeth formative years between the years of 5 and 8 put them at risk to this condition. Accumulation of fluoride deposits on such nascent teeth bond with the teeth composition to produce this browning effect. The cost of contracting this condition is the loss of self-esteem due to embarrassment resulting from either smiling or exhibiting a victim's dental formula in public.
And it's very, very, unsightly. And especially among young girls, adolescents. I mean, they go out and their friends are laughing at them, and of course some of them, they have friends. And I mean, to go out with brown teeth is not the best appearance that anybody has to put on.
Brittleness of the bone is also associated with the incidence of fluorosis. This condition is associated with aging process that may not be noticed during younger ages.